I chose to have a breast reduction for several reasons. It is something that I thought about for years and put off for a lot of reasons, and decided to finally have a consultation. And once I came to visit Dr. Delgado and talked about the process and the reasons why and the health benefits, at that point I made my final decision. And I really chose, I think, in the long run to not only feel better, but hoping that it's also good for long-term health. I feel like the surgery has helped my physical health so far. It's only been 5 months, from the standpoint that I just feel lighter. I feel better. I like to hike and kayak, and it's so much more comfortable to be doing physical activities with a much smaller breast size. I think that the emotional health from having a surgery like this is something that I'll probably experience. It's an ongoing process, and I'm 5 months out of a surgery that it took me years to decide to do. I'm amazed really every day when I go, wow, this feels great, this feels really good. And I think just that I feel that way obviously must be changing my emotional health. I don't think I was having emotional distress beforehand, but I feel good. I think it'll be a long-term process.
I had a previous surgery with Dr. Delgado, and I was very satisfied. My husband is a physician and is very particular about who he would have me see, and we just felt that he was the very best. And like I said, his whole staff is wonderful, and you just immediately feel comfortable and that you know that you're going to be well taken care of.
My initial consultation with Dr. Delgado was very positive. Again, I had thought about this surgery, the possibility of it for years. He had come highly recommended from my doctor in Santa Rosa, and I didn't know what to expect at all when I came in. I think that what was great was that I felt right away that he understood what I was feeling. And of course, I realize he's met with many people, but still on a personal level, I really felt that he understood. And the questions that he asked made me feel that the concerns I had, or even the concept of having the surgery, was not minimized at all. I mean, I guess I felt like there might be I didn't want to be vain about having a surgery like this. I put it off for years thinking there are bigger issues. But when I came to the consultation, we talked about a lot of the reasons why women in my position come to this point. And so I was very comfortable in meeting with him, and he was very easy to talk to. That was really fantastic. When I left, I felt really certain that I wanted to have the surgery.
I feel that Dr. Delgado really gives you the time that you don't feel with a lot of other doctors, and he explains everything very well. And again, his staff prepares literature that is very comprehensive, easy to understand and follow. And I think that's important because a lot of times when you're going through a life-changing experience, your thought process isn't always crystal clear, and you forget things that are said. So by having this comprehensive written material, you can go through it and be able to follow everything step by step, and it alleviates a lot of concerns and questions you might have.
The surgical process and the recovery, I feel, went as I would have expected, actually better than I expected. Again, this was my first surgery, and I did feel that I was well educated coming into the office, reading everything I could about having this surgery, and I feel that everyone in the office made it very clear what would happen once I, was in the recovery phase. I chose to stay overnight, so I had an opportunity to do some recovery here at the center. It was actually much better. I had very little pain, and it went well.
The surgery process and recovery was so much better than I expected. again, because I was just thinking I was going to be in pain and didn't know how long that was going to last. And as I said, after surgery, I slept very well that night in the recovery room, and then the next morning I was just fully up and ready to go, and no pain at all. And I don't know if I'm an exception to the rule, but I was exceedingly pleased.
The scars do not bother me, and I think the reason why, the reason that they don't bother me is because I felt that I was well educated before the surgery. Dr. Delgado had me come in to Janice's office, and we looked at pictures of before and after. We looked at pictures of scars. I was initially a little surprised to see how extensive the cutting would be, that the scars would be that large. But again, I was really certain I wanted to have the surgery, and I just felt like at my stage of life that that's okay. There's a trade-off, and I could live with the scars, so they don't bother me. It's been 5 months, and I'm not uncomfortable. They continue to flatten, and it's going really well.
My follow-up appointments have been excellent, both in dealing with Dr. Delgado and his support staff. Everybody is very helpful. Again, they try to explain the process of what's going on in the healing, and so I've just always felt very fully informed, and I couldn't ask for anything more, really.
My experience having surgery at the Marin Cosmetic Surgery Center was, again, a very positive experience. When I arrived, I was mentally ready for the surgery. I felt well taken care of. There were several people that were able to give me their attention to make sure I was prepared for the first step and the second step and so on until we got into the surgery room. Again, it was my first surgery. I have nothing to compare it to, but again, all the people have been very positive. And I think when I think about just being in other offices, this office runs really well. And I just feel that very strongly, and it carried all the way through to the surgery center as well. I stayed overnight. I had a fantastic overnight nurse. I'm glad that I did that. It was great it was an evening surgery, so it was very nice to know that I'd have that monitoring through the nighttime. I would have liked to stay longer the next morning.
I used to get really bad pains through my neck area this way, and my back as well, but more through my shoulder area, and I really can say I haven't had that experience since the surgery.
I think in the physical sense, it is just almost hard to put into words how you feel after a surgery like this. You get so tired of your blouses gapping, and I'm sure many women can relate to this, putting a safety pin in between because, everything else fits in the shoulders, but not in the bust. And it's pretty amazing to go into your closet and try clothes on that you've been wearing as an over blouse and know that you can button it up. That part's really exciting, and I'm the type of person that would have been one of the last people that would have thought that they would have come in to do a surgery like this thinking that, it's about your looks, but it's about how you feel. And I just believe very strongly that this was a good decision for long-term health. So far I've been lucky I don't have back pain, I haven't had neck problems, but I had started to notice an indentation in my shoulders. I'm 55 now, and I thought, I plan on being around into my 80s and 90s. I don't think I have to live with this. So this was a fantastic decision, and that's how it affects your physical well-being, is that you just feel lighter, you feel like your posture is better. I think when you have large breasts, you sometimes accommodate and change your posture a bit, although I've always tried to stand up straight. But now, I feel like, wow, I can carry myself and not think that those breasts are in the way anymore. And that feels great.